morning, everyone. My name is Stephanie Vargas. Cameron Martin Wise was born on September 26, 1992 in Albuquerque, New Mexico. All throughout his life, Cameron enjoyed being active. He loved to water ski, hike, and play sports like football and wrestling. When Cameron was 16, he broke his collarbone in a wrestling accident. He had to have surgery, and he was prescribed opioid painkillers, which are a class of highly addictive drug that include medicines like morphine, Oxycontin, Percocet, and fentanyl. A few months later, Cameron broke his other collarbone while he was playing football. He had to have surgery again and was prescribed more opioids. Over the course of the next 6 months, Cameron became addicted to opioids. And once he no longer had easy access to pills, he turned to heroin, which was not prescription but provided similar effects. Drugs changed Cameron almost entirely. He went from someone who enjoyed spending time with his family, friends, and teammates to someone whose primary focus was heroin. He died at home on August 13, 2011 due to heroin overdose. He died surrounded by childhood stuffed animals, his favorite blanket, and various sports trophies. As his mother detailed to PBS, no one remembers Cameron as a drug addict. They simply remember him as a young man who lost his life far too soon. And unfortunately, stories like Cameron's aren't uncommon. In 2016, the U.S. Department of Health and Human Services reported an estimated 42,000 opioid-related deaths. And not only is opioid crisis affecting the entire nation, but it's hitting particularly close to home. Maryland is among the top 5 states with the highest rate of opioid-related deaths. Additionally, as of 2018, the the Maryland Department of Health reported that Anne Arundel County has the second highest rate of opioid overdose in the state, following only behind Baltimore County. So it's clear a significant number of Americans are dying from opioid overdose. But what exactly are opioids and why are they so dangerous? How did this crisis begin and what is currently being done about it? So to better understand the opioid crisis, you have to understand what opioids are, what the major types are, and how they cause addiction. Opioids are a type of painkiller which can be derived naturally from the opium poppy plant or made synthetically. Some of the most common prescription opioids, like I mentioned earlier, are Percocet, morphine, codeine, and fentanyl. And heroin is the most common non-prescription opioid drug. Opioids are mostly prescribed by doctors for injuries, surgeries, cancers, and even some dental procedures. Opioids can be effective if they're used for a short amount of time, but they can be highly addictive. They cause addiction by binding to and activating receptors in cells located in the brain, spinal cord, and some other organs. Once they bind to these receptors, they block pain signals sent from the brain and release large amounts of dopamine throughout the body. And this release of dopamine makes users feel good, it boosts their mood, and it makes them more likely to want to repeat the experience again. As with Cameron's case, often once opioid prescriptions are no longer available, users will turn to non-prescription opioids like heroin. So there's obviously a high risk associated with opioids. So you might be asking yourself, why did they become so widely prescribed in the United States? Well, in the early 1990s, pharmaceutical companies were marketing the drugs to prescribers, and they reassured them that they were not addictive. So doctors began prescribing them at higher rates, and as a result, the number of opioid-related deaths started to increase as well. For the first time, communities in the United States started seeing the effects of opioid abuse and its illegal trade. Opioids were now becoming the newest commodity on the drug market. So now that you know a little more about opioids and how the crisis began and progressed to this point, we're going to turn our focus towards what's currently being done about it. The U.S. Department of Health and Human Services, HHS, and the National Institutes of Health, NIH, are currently working to fight back against the opioid crisis. HHS has reported that it's focusing its efforts in 5 different areas. One of the ones that I'm going to focus on today is increasing the use and availability of opioid overdose reversing drugs. Last July, as some of you might have heard, pop star Demi Lovato was admitted to the hospital after an opioid overdose. The paramedics administered Narcan, which is a common opioid overdose reversing drug, and it effectively saved her life. For Demi and a lot of other people just like her suffering from opioid misuse, opioid overdose reversing drugs are providing a second chance at life. So NIH has also been working on ways to discover ways to prevent and treat opioid misuse. In the summer of 2017, NIH met with pharmaceutical companies and academic research centers to develop better strategies to manage pain and medications and technologies to treat opioid use disorders and improve opioid overdose prevention and reversal interventions. So in conclusion, we've seen that opioids are highly addictive drugs. They can be derived from the opium poppy plant or they can be made synthetically in a lab. They bind to receptors in the body and block pain signals sent from the brain. They release dopamine, which is what really makes them highly addictive. The opioid crisis began in the 1990s and has progressed not only to include prescription opioids, but also non-prescription opioids, like I mentioned before, heroin, and also illegally produced fentanyl. Efforts are currently being made by the US government to fight back against the crisis, to invest in better research and pain management strategies. The opioid epidemic is clearly a pressing issue in the United States. And with the high prevalence of opioid misuse, it's not unlikely that you know or encounter someone who's suffering from the drug's effects. I myself have a very close friend, her name is Skylar, and her mother had knee surgery a couple years ago. Afterwards, she became addicted to opioids. And luckily, she had the chance to get help and recover, but not everyone is as lucky as her mom. The opioid crisis is real, and it's affecting lives of people all around us. After all, if it could happen to someone like Cameron, after just a few simple sports-related injuries, it could easily happen to any of us. As Andrew Colondi, opioid policy researcher at the Heller School for Social Policy and Management puts it, there is no segment of society that has been spared from the opioid crisis. Thank you.